Hi, I'm Georgina Kyriakoudes. I'm the CEO and founder of Aria Health. We are a blockchain-based health data company that rewards patients for contributing their health data to medical research and engaging in their health. I'm really excited to be here today on Voices for the Future.
We have Georgina with us on Voices of the Future, and this is a bonus episode. She's our bonus voice, and I say that because she came here for a meeting, and I assumed we were having an interview. And guess what? We're here together. We're having a chat because I think what she's doing is quite incredible, and it's very, very relevant for us as we look into the future. So we're delighted to have Georgina here with us today. And we're going to be talking about blockchain and techie stuff and metaverse and data and boring stuff, but we're going to make it really, really interesting and cool. Georgina, welcome. Good to see you.
Thank you very much. Very happy to be here.
And you know, I was being facetious, but you know what I mean. I think we can tell a story around data and make it interesting. And even when we talk about data, when I talk about data, I have a hero, I have a villain. Trust to me is the hero,
yes.
and lack of trust and lack of transparency is the villain, and
exactly.
we'll look at it from that perspective. So, Georgina, tell us about little Georgina. Was she naughty? What was she learning? And were you going around killing insects and stuff like that, or were you doing real stuff?
Well, it wasn't killing insects, I can tell you that. Yes, so I mean, I grew up kind of all over the place. So my father was in the army, so we moved countries every 1 to 2 years. So I was always from Europe and Africa, every year to a new school, to a new place. So I really got used to meeting new people, being in new environments, and really loved that sort of experience.
And that sort of started shaping you?
Very much, you know, I got used to, I love change. I'm actually, where a lot of people, let's say, are looking for certainty. I'm looking for uncertainty. I want that something new, what's going on, and where is that? And I think that is because I've been shaped of okay, what next? And so I think that definitely has really shaped me. And I was always sort of the one looking for what's different. I don't want to do what everyone else is doing. I want to see the other ways to do things. Probably sometimes too much, different for the sake of different, but as you mature,
which is amazing and great, but you ended up becoming an accountant.
Well, yes.
So that's not different, because I'm a failed accountant and I can totally relate to that.
The other side of that is I had a money box with times tables on it when I was 6, anyway. And that was my favorite toy. But actually it was a bit different. So I was at school, did my A-levels, and the normal thing was, okay, everyone off to university. And I went, no, I don't want to do that. And everyone's like, no, come on now, don't be silly, you're going to university. I applied, I got in, I was going to go to Edinburgh or Exeter. And I said, no. My parents said, what are you going to do? I'm not sure yet, but I'm going to go to London. You're going to go to London by yourself dating? Yes, I'm going to go to London by myself dating. Worked in some pubs and then was like, okay, I don't think it's going to work out long term. And so I found out there was a job at PwC. They take on 2,000 graduates a year and 30 non-graduates a year. And so I actually ended up, that got me into that path. As I said, I always loved numbers. But so even that was a bit of a different path they took.
I don't think it was different. Because people who come from my color and my background, at that stage, I was coming into London and I wanted to, read PPE at Oxford, and that wasn't considered a real degree. My dad said, I think you should get yourself a professional qualification, doctor, lawyer, accountant. And I ended up in accountants. And I said, Dad, please, I'm not a bean counter. I mean, I'm lots of things. I'm not a bean counter. And I passed my first exam, my second professional, I failed. And that actually changed my life. It put me on a path that I never, ever thought. Because in failure is where I learned the most. I remember I was working in a sleazy nightclub in Lower Regent Street called Samantha's, and I and at 3:35 a.m. I used to come out. I was too poor to take take a taxi, so I took the night bus at 4:10 going to West Hampstead. So I had about 25-30 minutes every night when I was out there, and I remember a little hole in the wall in Carnaby Street, a little plank of 2 planks, And I was sitting there with prostitutes, with dustmen, with and an associate professor of philosophy, and me, failed accountant. And I didn't tell my parents because I was too embarrassed. I didn't know how to handle failure. And in that environment, that's when I discovered myself. I discovered humility. I discovered not to judge people. I discovered that we can be down and out and then bounce back from there. I hit rock bottom, basically.
Yeah.
And that to me was an important learning for me. So I am much less worried about failure since then than I was before then, because I did share with my parents that you gave me love, you gave me opportunities, you gave me everything, but you never taught me how to fail. Because I was always an A-level student and I was always right at the top. And my incentive was, I can go out and play sports and chase girls as long as I keep getting A's.
Yeah.
What an incentive. When you're 16, go and do what you like, you got to get your grades. So I was built and trained and hacked. My brain was hacked around success. So failure wasn't... tell me, have you had any failure stories and failure issues? Because you look perfect to me.
Of course. Of course, yeah. I mean, having a startup, I think 90% of the job is failure and rejection. That's how you learn.
Experimentation and learning.
Exactly. I don't consider it failure. So when you ask me that question, I think, well, immediately, no. But it's not because I just don't perceive it maybe as failure. It's just stages in the journey, you know.
Sure, but I mean, I've had spectacular failures. I've had like my failed accountancy, and then I came here, got jobs in Dubai and so on. But beyond that, I mean, startups that I had to close, charities that I invested in that I had to let go, relationships that fell apart. All of these are monumental events in one's life that actually help you to grow. I've had enough of those.
Yeah, definitely. And I mean, for sure, you need those moments in life to say, okay, what's going to make me change? And so, yes, for me, it was first, I don't want to go to university. Everyone's telling me I have to. That's not what I want to do. And so I just
did something different.
Got up and did something different. Yeah. And, you know, it was first working in also a sleazy Wetherspoons in London, where there was Chelsea Football Stadium and Fulham, and they did not get on well. And I remember one night someone being hit over the head with a bottle. And I said, you know what, I don't think I want to work here anymore. This isn't for me. And so then I got up and I said, okay, what next? Found PwC, worked at PwC, you know, loved it there for its time, but also realized this isn't for me. What next? So I got up and moved to Cyprus. And through that was exploring. I started, I sort of stayed in the accounting profession I worked there, didn't enjoy working in where I was. So said, okay, I'm going to stop this. And so I guess you could call these failures. I was like, okay, this doesn't work for me.
Sure.
Went to another company, very excited. It was a new growing company. Didn't work out. Okay, what next? So there have been a lot of pivots like that. But and you could call them failures.
Pivots is a good word. Failure is a different experience. But in those pivots, you started connecting the dots as I see them. You had your accountancy, you had your health, you have your experiences in different roles. Tell us about your current activities and how the dots connected for you there.
Yeah, so it's always easy to connect the dots backwards, isn't it? I think while I was doing it, I was slightly, always going for what looked like a good next opportunity. So after deciding, yes, accounting profession's not for me, I want to go more into the business world. First I worked in a fintech company that you could say was a failure. So I had to leave and I went to university and I started there. I had an opportunity to build the online education platform. And that's really where I first got into that sort of experience of building something, of development, of sales teams, of marketing, of customer product fit, all this, and went through that. And then that university was the first university in the world to do a master's on blockchain. And originally, they came to me and they said, the accountants and lawyers are worried that crypto's going to come, and how are we going to account for this? That was our number one concern. How do we account for this? What are we going to do? What if fiat, gets replaced? So they said, can you build education seminars on this and start applying it to the industry? And even, we think about boring stuff like how do we IFRS standards apply to crypto. But while I was building that, I realized, wow, this is a really fascinating topic. And the whole idea of for me, it's changing the way decisions are made. So instead of having, the central entity makes all the decisions, it's actually bringing the community voice in and having that, wisdom of the group approach. And so I found that really interesting and decided to do the masters. So they just started, so I was the second group. So that's where I then went into doing the masters. Learned a lot. And when I got to my thesis, I said, I don't want to do the traditional fintech applications. I want to see where else can this go. And that's where, well, actually in that case, I have a co-founder, and his wife was rushed into hospital. She was in agonizing pain. They had no idea what was wrong with her. And she was made to wait for more than 4 hours in the hospital while they searched for, has she had past surgery? Has she got allergies? Has she had any conditions? And it was just sort of luck that a doctor came by who knew her, took her through, found out she had an ectopic pregnancy, was bleeding internally. Thankfully, all was okay. But it was then that we realized, wow, we have access to so much information, but not to our most important data. And so there is where I sort of thought, okay, you've got blockchain, which is all about individual empowerment and ownership and security of super private information. And then you've got this health information which is scattered and we don't really know what's happening to it or where it's going. And so that's where kind of we brought that together, and then that led into first a research paper we published in the Lancet, worked with sort of a lot of different stakeholders, and then said, okay, let's build this. Let's try.
Interesting. I mean, I think most great companies are created around solving a problem, and you are solving a problem because healthcare data is very dispersed, very disorganized. Just like in a bank, I mean, the same bank with different departments, they ask me for all of the information again, kind of stuff. So you go to a hospital, you have to explain this, and you go to another clinic, you have to do it all over again. So integration or lack of integration of data is a serious issue. Privacy is also a key element. So I dare say through blockchain, your smart contracts and others can start addressing that. But beyond that, I think data to me is not the raw information. Data to me is much, much more about insights. If it's looking at the genome structure of the whole of the United Arab Emirates, which, by the way, is happening. It's a small country, so they can do it. So you can understand what kind of things are happening and so on. But then if you look at one country and then you connect a second or connect a third, suddenly it starts changing. I work with a company in the US, and they were helping children's cancer hospitals. So can you imagine, here's your child who has cancer, potentially terminal, and you're sharing that data. And initially there was a lot of issue around the ethics of doing that. And the way we thought about it was that what can we do from hospital A, kid 1, to hospital B, kid 2, to hospital C, kid 3, and see what are the commonalities in there and see how we can help them. At that moment, the parents and the doctors and the administrators started saying, as long as we remain anonymized, we can start sharing and finding out this thing. And this could help solve a lot of problems and disease and so on. Even the pharmaceutical firms, for example, most medicines, most research on diabetes and various others is done on white Caucasian males. Therefore, you have very, very still the things. And now, diabetes on white Caucasian males, highest incidence of diabetes is Black people and Hispanics. Hang on, this is not connecting.
Exactly.
So you need to start doing different kind of trials and stuff. So these are just some of the problems as I see them from a data perspective. What are the key elements from this sort of narrative that I've shared with you that you're bringing into Area Health?
Yeah, so I think that element of things being anonymous is very important. So of course, the truth is, it's, as you said, the insight. So the raw data itself is not necessary. That individual data is not so important. It's sort of in that group and bringing more diversity to that. But I think we need to go a step further, because still there's a massive lack of education on why this data is so important and how it's being used. So now we hear stories, I mean, for example, 23andMe, they sold 10 million DNA records to GlaxoSmithKline for $300 million. Or the NHS England, a couple of years ago said, we're opening up access to all your data. If you want to opt out, please go to this website, download this form, print it, sign it, take it to your local GP, and you can have your data. And what was really sad about this, particularly the NHS cases, they actually were only using anonymous data for medical research. But the reaction from the public was like, I'm sorry, you're taking my information and sending it to who you want, and I don't know what's happening with it. And so it's a combination of educating people on the importance of this data and how the positive impact it's having, but then also bringing transparency. You can't just turn around to people, and most of the time people don't even know.
Yeah.
I mean, that's a good case where people found out. And so this is where the blockchain is so important, because you can trace all that information, and that's what we're doing. So we get data, well, either from the patients and from hospitals and healthcare providers, and it's all encrypted with the patient's private key, so only they can access it and decide who shares it. We can't see it, no one else can see it until they say so. But even then, it's still anonymous, and it's all linked. So all this data comes from many diverse sources, and this is one of the difficulties with anonymous data is, okay, great, I have some data here and some data there. How do I know it's the same person? And I want to see that full, complete picture to be able to really understand a person's disease and the profile. But with blockchain, we have an identifier that we can kind of link this information together, but then we can share that information, trace where it's going, and then be able to use it in anonymous state. And then the other element of that, so one, as a patient, I'm making the decision who's using my data. I can see where it's going and how it's being used, and I can pull it back as and when needed. But then what we now do with whether it's universities, medical researchers, pharma, we say you have to say what you're using it for. And then we make sure that they start giving education back to the patients, saying, your data, you have diabetes. This data we used, we brought it into a clinical trial. It led to the development of this new medication, or it led to the identification of this new symptom, which we've now made a change, which can have this benefit. And this is how it's benefited your community. And so that completely then changes the narratives. When people start seeing it that's not medical research, sounds so scary, but my disease, my medications, and this is how it's impacting new health technologies. Then people go, I want to contribute. Most people want to contribute.
Indeed. Yes. So to most people, the eyes glaze over when you talk the blockchain. They think it's all crypto and something super dodgy, and it's a distributed ledger. Yeah. And therefore you can do that. So I think if people can start learning to trust that, and that this really is a trustable, anonymous environment where we have the key, I think that could be interesting. If you ask Google today, and I would like all my data back, please, they will say, absolutely no problem, here it is. And I'll tell you why, because they've already sucked out the insights.
Yeah.
So therefore, you can have your raw data back.
You can have the raw data. I've got everything I need.
So therefore, I think it is a different way of addressing this kind of problem. So that's number one. NHS, you mentioned it a couple of times. The valuation of NHS data today is somewhere between $60 to $100 billion. So it's a question of monetizing that, and NHS will be fully financed for the history of the future on that. I'm serious.
No more taxes.
And nobody's going to do it because people don't have the balls to go out there and, politicians and so on, to go in and do something about it. Seriously, if I was the Prime Minister, I would say, I'm sitting on $100 billion here.
Yeah.
How do I make it safe? What do I need to do? With the purpose that I'm serving NHS and I'm funding NHS for the next 20 years.
Yeah.
And I think we need to change stories. We need to change the framework. It's not, I need your data kind of thing. It's like, here's an asset which we're reinvesting back in. What are your thoughts of unlocking that piece for something like you?
Yeah, so, again, one of the beauties of blockchain is it's all about collaboration and bringing in. It's not about I'm a competitor, you're a competitor. It's about networks and collaborations.
Yeah. I know when people talk about DAOs, distributed autonomous organizations, I haven't seen a DAO working yet, realistically. So
Yes, and
theoretically, wonderful.
there are
Sorry, I'm asking a
scales.
lot of intelligent questions here. Sorry about that.
There are definitely scales to, like, for example, I'm not a diehard, everything needs to be decentralized. There are, like, especially in healthcare, where things are sensitive, you need some centralization elements. But understanding that, for me, a core part of blockchain is about designing incentives, mechanisms, which encourage people to do the right action. So in this case, for example, for us, yes, revenue will come through to our marketplace because of the utilization of that data. It could just be insights, you're not necessarily getting that data, but then through smart contracts, we can distribute that back. So back to the healthcare provider and back to the patient. So for us, the key is to the patients. In that case, yes, if you said to the patient, your reward, let's call it, is to get free medical service for the rest of your life, I'd probably say, that's a good use of this. But it comes down to, why would a politician, why will they not stand up on stage and say that now? Because everyone would go, I don't trust you. I don't trust what's happening with it. And it's not even I don't trust you, it's I don't understand.
Absolutely.
Yeah.
And my first slide on most of my futuristic presentations is what's going to define the future, and I say trust, truth, and ethics. And I think that trifecta is really what was deciding this thing. And in my simplistic way, I'm not as smart as you are, so I need to look at blockchain, and to me, it was all about trust. Yeah. And I used to call it trust networks, not blockchain networks. Blockchain sounds too techy.
Exactly.
So really here's a trust network, and this is how it works, and this is how nobody can hack it.
Yeah.
It's almost unhackable because it's distributed in so many places. So therefore, if I'm building trust networks, and that's the data trust that you create.
Yeah.
Perhaps that's a new way of framing it and sharing this, telling people the story, as opposed to saying, I need your data, because then everybody, like that.
I think as long as people feel that, yes, that's a trusted network that I also still have a say over, because, there are networks being built for health data, blockchain networks, but the patient's still not involved, or they're kind of half involved. And it's like, because it's also, there's two problems in healthcare. One problem is lack of access to data, and the second big problem is patient engagement. We need patients to be more engaged in their health, to be more motivated, whether it's to do their preventive checks, come to their appointments, take their medication. So actually, this is only one piece of the problem, whereas I see we have this opportunity to solve both problems at the same time by giving patients empowering them, giving the rewards, and you do two things. You, one, get them to be healthier, which saves money for the healthcare systems, etc., but then also gets them involved.
You just pressed the button.
Okay, I'll wait for that one in a moment. But it also gets them involved in actually saying, okay, I'm happy for my data to be shared, but I do think you can't just, I don't think if someone stood up and said, oh, we've got a really trusted network, don't worry, I'll take care of your data, I still have to trust you.
Yeah.
And I still want to at least be aware and engaged on what's happening.
Understood.
So tell me, go on,
the button,
press that button.
The big nuclear button, the red button that you just pressed was, you talk about healthcare. As it exists today, it doesn't. To me, it's sick care.
Yes, true.
And that's the first thing.
Very true.
Then you have hospitals that are there, and they exist because they make money. NHS is slightly different, and I respect a lot of the work that they do. But generally speaking, private healthcare, that's where you make money. Then you have the leeches called the pharmaceutical firms, who want to keep these people unhealthy so they can make their lifetime's elements. So they are the third P. And then you have the vultures, who are called the insurance companies, who are there. And then, while all of this thing is going on, the food companies are saying, hang on, we need to have more diabetes and more sugar and more McDonald's and more this, so that and pharma loves that. And healthcare loves that. Everybody loves that because most people are getting sick and fat. I mean, 80% plus of the diseases today are self-inflicted. Cardiometabolic diseases, all of them are self-inflicted today. 100 years ago, they were all infectious diseases. Today, They are self-generated diseases. So when I'm looking at it, these 4 or 5 touch points, the hospitals, the regulators, the insurance companies, the pharmaceutical firms, and the food companies, the sugar companies, you put them all together. Oh my God, where do I go with that? I honest to God truth. And the amount of money they all make, they have more money than God. They're not going to let this shit happen.
Unless you change the model. And
so how do you reframe the model?
Well, I mean, the big one that they're really trying to move towards in many countries in Europe is value-based care. So you don't pay a hospital based on how the appointments or the treatment, but you pay based on the outcomes. So, for example, if we see your glucose level going down,
yes,
then that's a benefit. Now, also, having worked with some of the farmers, that also then they're being encouraged then. I worked with one of the farmers, they were saying, we actually have some really amazing medications for preventative health.
So now we're getting closer.
Still selling something, but in the right direction. And they said the problem we have is we can't sell it into the governments because they say, prove that it prevents this illness. It's very hard to prove that something doesn't happen.
Yeah.
And so that, I can prove you have diabetes, now you don't, but I can't prove that you would have, but you didn't because you took this.
Why don't we just reverse the incentive? You're talking about outcomes. We are used to that kind of outcomes, which is, teachers, should they have outcomes? In terms of education, I think they sort of should, but do they, and how they? But on the other hand, what is the outcome? And on the other hand, the school industrial complex, education industrial complex, making a ton of money based on what outcomes?
Yeah.
So you see, a lot of my skepticism is coming through.
It's definitely. This is not a simple problem. I'm going to bring it back to blockchain. It's all about aligning incentives, and I think that's the huge thing here.
I totally agree with you. So let's just go look at the hospital system and the government system and say, we're going to reward you if I don't come to hospital. Preventive care to the point that my incentive is that they, absolutely. So they are now calling you up and saying, Georgina, are you taking your supplements? Are you taking your meds? Are you walking 10,000 steps a day? Are you doing this? Are you doing that? Because I don't want to see you. And if I see you in the next 12 months, I'm going to lose my brownie points.
Yeah.
And therefore, please don't come. Keep doing this. And I'm being facetious, as you can see, but it is really quite serious that if we can look at reversing the incentives towards prevention rather than curative healthcare, perhaps we have a starting point.
Yeah, exactly. I think it's a long way to go, and it's still that balance, because I think there's always that concern and saying, yeah, but I want to come. Sometimes I need to see my doctor. I don't want to be told, no, you're fine. So finding that line.
Come for consultation,
but
come for coaching,
preventative checkups,
preventative checkup. Just test your vitals and get your diagnostics done and go away. And I don't want to treat you. I want to keep looking after you.
Yeah, so exactly. Yes.
Patient care becomes, because now technology can do all the diagnostics far faster and far better and far cheaper than any doctor can or a nurse can. But the care is where the value is.
You can't remove that.
You can't remove that. Yeah. So we shifted to care, not to diagnosis.
Exactly, yeah. You shift that relationship towards actually because now the doctors are so busy, they're understaffed. You feel that. You walk, it isn't like generations ago where you knew your doctor and they knew everything about you and you're wondering. Now it's when I can get an appointment, it's someone new. As you said, you're going to different places, you're just spouting. Do you take medication? Yeah. Have you ever had surgery? When did you last have this vaccine? And there's no sort of relationship there. The
name is failing me right now, but there was a company based out of Seattle, Washington, where it'll come to me in a second, where if you were my doctor and we were having this conversation, you would have an iPad or an iPhone there that would be recording our entire conversation. So by the time I have completed our engagement, it's done all the research and stuff like that and produced the outcomes and sort of saying, Georgina, these are the following 3 things you need to do. This is what the research says, whatever. Because doctors don't need to be diagnosticians. They should be healthcare providers.
Exactly.
They should be So it's about judgment, care, and all of those wonderful things. So these are the kinds of things which technology enables us to do today. You cross-fertilize it with blockchain and other variables. And you got yourself a winner. So when's your unicorn going to be?
Give us a year or two.
It'll take about a year.
No, we've already launched in our first hospital, so we have that running. We've got some big projects with the government of Cyprus. We're working with some hospitals here, so you will see more.
I look forward to that. We're having a lot of fun, and I know I'm being a little bit silly and stuff, but I think these are really important questions that we need to address in the world. Let's put you in a time capsule. Let's take you to your 100th birthday.
Okay.
What do you see around you? Who is there? What are they doing? What does your business look like?
Yeah, I mean, I guess the way that I think what we need in terms of the health data is I see a layer and infrastructure where everyone can be plugging into this information, and that can be at a personal level, and it's, as you said, you're using your AI, you're using the next thing to AI, I'm sure they'll be right then, to be getting that real-time monitoring and outcome of how am I, where am I going, even preventative, like potential directions that your health can go in, and having that guidance on, okay, what should you be doing now to change that? But yes, and then also, the doctor being able to plug into that information and get those summaries, and just being able to have that really integrated across, but have it at a much more personalized level that can really guide you through your journey. And as you said, more in a wellness and preventative ideology than a sickness one.
Indeed.
Yeah.
My final question as we bring this to a close, if you were to put a little message in a bottle and a one-liner, an inspirational statement or something, what would that be that we would find in 5-10 years' time? That Georgina dropped this message in the bottle of Voices of the Future, and now we've discovered it.
One line, that's difficult. I would say that the direction I would take this in is towards communication and personal skills. I think that's the one concern with technology and the way we're moving, is that I particularly see it with children, like they're losing that ability to just communicate. So I guess I'd say something like, don't forget people, remember we're here, and connection and community is ultimately the base for everything we have.
Yeah, indeed. Yeah. We've just been talking to Georgina on Voices of the Future, talking everything health, data, care, a lot of little stories about the pharmaceutical industry and the healthcare, sick care industry. But I think it's an important conversation to have, and we need to reframe our conversation into something different. We need to share different kinds of stories, build more trust, and build more ethics in a lot of the things that we do. And that's what we discussed today with Georgina. Georgina, thank you very much indeed.
Thank you so much. It's been a pleasure to be here.
Pleasure. Thank you very much.